Welcome, guys. How are you?
Hi,
Great,
Israel.
great
Awesome.
today.
Fantastic.
Perfect.
That's great.
Ken, you are from Canada, right?
Yes, I am from
And
Vancouver, Canada.
There you go. And we are located in Los Cabos, Mexico. How did you found out about NSP?
Well, we heard about this place through friends of ours who live in Cabo, Los Cabos.
Okay.
So she's a client here who comes here quite regularly, her and her husband, for different things. So when we spoke to her, we were down visiting her, I guess about a month ago. She told us about this place and brought us over and introduced us to yourself and other people here. So we decided to go back to Vancouver after a great meeting, after meeting Dr. Rincon. We were so impressed with the presentation that we thought, well, we'll do some research and see if this is what we'd like to do, because I've been having trouble with my neck for years and it was getting worse and worse and worse. And we're at a point where when I finally got to see Dr. Rincon, when we come down to see him through the referral with our friend Wendy, I visited him like this because I couldn't move my neck. I was in tremendous pain. So Dr. Rincon said, well, let's do an assessment and see where we stand with you. So that's how we ended up coming here, right?
Exactly. To be honest, when we first met Dr. Rincon, we were just thinking we would get a second opinion of Ken's scans that he'd had back home, just to see if the diagnosis was correct. They said he had degenerative disc disease and a lot of osteophytes, bony protrusions. So we just really thought, let's get some x-rays and MRI and let's get a different opinion. We didn't even know that there was an option available to help Ken, because back home in Canada, they said all they could really do was completely fuse the cervical spine, which would relieve the pain, but would have left him without any mobility. Here we are in a consultation with Dr. Rincon,
Yes.
and he's saying, well, I think what would be really a good option for you is artificial disc replacement. And we looked at each other because we'd never even heard about it in Canada. And so all of a sudden we had hope that there was an option that we didn't even know existed.
What was your reaction when they told you we do have an option that could allow you to maintain your movement?
We were pretty excited about it. Dr. Rincon was realistic, and he reassured us that unless we qualified for this particular surgery, he would not do it under any circumstance.
Unless Ken could really benefit. He said, I'm not going to operate unless I know that you will benefit from it. And so we really had to fulfill a lot of requirements in terms of certain things that would show up on the scans,
MRI and
make
scan,
sure the facet
CT.
joints weren't locked. He said, if there could be any harm to you in any way, I cannot do this procedure. So we left excited, but still not really knowing if Ken was going to be a candidate. Yeah. So when we finally got the news that he was, honestly, we've never been so excited to know that we're going to have a surgery.
Yeah, I was so excited. I wanted to get here the day of the surgery, just go straight into the hospital and get it done. But we decided, we met you.
There you go. And I came into the picture.
You took care of everything for us. We couldn't imagine anything going any smoother. So we couldn't dream of it.
Honestly, you are one of the first people that we are bringing. We call this medical tourism. Yeah, because we understand that there are various parts of Mexico locally, but also state-wise and obviously international-wise. This type of surgery, which is the cervical arthroplasty, which it was at the level C4, C5, C5, C6, C6 and C7. This is exactly what they did to you. Not many people know about this type of treatment. So this is one of the reasons why we're doing this interview with you, Ken, because you are the first person who we are able to get your testimony after the surgery. Because this testimony is right now, how many days after the surgery today?
We're 3 weeks basically today.
So after 3 weeks, you're ready.
So after 3 weeks,
actually after a week,
we were doing well. We were out walking. Yeah. So and I was able to. Dr. Rincon, the only thing he promised is after surgery, because of the top 3 discs, they're already fused. So he couldn't do anything about that.
Okay.
So he said, you're not going to get, like the exorcist, you're not going to be able to move your head all the way around. But he said, I can assure you, you're going to get at least 20 to 30%. Well, I know I have that now, and I believe it's even going to get better.
And the pain is gone.
The pain is gone. That's the main thing. He got rid of the pain. He promised, he said, with this surgery, one thing we will do, if we do the surgery, we'll get rid of the pain.
And the pain was debilitating.
That was
How
debilitating.
important is it to feel no pain, Ken? Like,
Oh man, it feels like $1 million. No, 100 million.
oh my God.
It was awful. I couldn't sleep at night. Couldn't, at the point where, just because we like to walk a lot, so walking, and every time I would walk, my feet would hit the ground and my neck like this, right? Just brutal.
Quality of life, you would
Quality
say
of life, yeah.
has increased after the surgery.
Absolutely.
No,
Absolutely.
that's amazing. We're focusing on the actual surgery itself, but we didn't just do the surgery. There was also other people involved to take care of you, just like first contact doctor, always providing information, which is Vanessa.
Yeah.
But you also went with Doctora Montes de Oca. You met her. What did she do to you? What did you work with her?
With
Doctora Montes de Oca. She is the rehab specialist.
She did the ultrasound on your shoulder and
yes.
the injections.
She's brilliant. I mean, she walked in the room and I couldn't believe it. And she, like, mentally took me apart right there to figure out what my problems were and what she could do. She, stripped me down, and within a half an hour, she had it nailed what I needed to give me the comfort of my shoulder and my back and around my neck area. And she just immediately started working on me. She gave me those little needles.
Dextrose injections.
Okay.
She assumed that your muscles were really tight after the surgery.
Yes.
Everything adjusting to its new.
Yeah, because of course with the disc replacement, my neck went up probably a half an inch higher than what it was.
You did seem taller now that
I
You do look taller.
Yeah.
So that's part of the service, get you a little bit taller too, it seems like.
Yeah. I'm glad he didn't leave me when he took them out, because I would have gone down. So I'm glad he put new ones back.
Oh,
it was fantastic. I mean, everybody here, like I said to Dawn before we came over here today, I just said, if I could rate this place from 0 to 10, I would have to give it a 20. I mean, we've never experienced anything like this anywhere we've been. We've traveled the world. We've never experienced the type of care and compassion and literally love that people had for us here. And it was just, it's beyond anything we've ever experienced, right?
And we thought, is it just us?
Yeah.
Then we've been in the waiting room, waiting for his physiotherapy appointments really almost every day. And as we sit there, we watch how you interact with every single patient that comes in here.
That was the only thing that ticked me
And
off,
it's not
actually.
just
I really
us.
thought it was just us. But then I found out everybody gets this.
Yeah.
That was kind of disappointing for me.
I'm so sorry, Ken. We'll try to make sure to give you a specialized treatment for you too.
I don't know how you guys spread yourselves around to do what you do here. I will never understand it. I don't need to understand it, but I know if I ever have issues, I know where I'll be coming.
And where our friends and family.
We're going to be the greatest ambassadors for this place that you won't believe.
We do need some ambassadors, so this might be changing from a testimony to a presentation of our newest ambassadors.
As we come to visit our friends down here, we'll be coming to visit our new friends here, because this is like our family for the last 3 weeks.
No, we appreciate you
We've been embraced. I mean, it's unbelievable.
No, honestly, I gotta say, you guys are just a delight. Also, you guys are.
You
like
say that to everyone,
patient.
though. That's my point.
No. We have also types of patients, but you guys, since day one, you guys were told what you guys had to do. You guys followed the instructions of the doctor. That is one of the most important things. Sometimes people don't see the importance of following these instructions, doing a little research as well. So everything you guys did, it allowed us to help. It helped us to help you, because you guys weren't just like, I want to do this, I want to do that, and no, I don't think this is the right way to go. Like, you guys were always optimistic. You guys were always trying to get your mobility back, and then that allows the doctor to to flow with you guys. Obviously, work better, and the team obviously just we're a collective system. So,
we've had a ball.
No, it's beautiful. I get to sit here and see the beautiful part of Dr. Rincon's like magic, because he honestly really does change the lives of people.
He sure does.
His compassion, understanding,
level of skill.
It just flows to all
his entire team.
The entire team, yeah, it flows down through. But just talking to him, it's not. It flows down. It goes across. He considers everyone equal to him.
So important.
And it's amazing. I mean, we've met his wife now. We've met his sister and children. I mean, it's unbelievable. And they go out of their way to hug us when we go by. And it's, I don't know what else I can say, but let me just say this. If anyone out there has injuries that they need to be taken care of, this is where you have to come. Never seen a place like it. Never heard of a place like it.
Okay, and that's beautiful. Thank you. We appreciate you guys. You guys have no idea. You guys are always welcome here. Honestly, we'll think about the ambassador area. Yeah, we like it. We like the idea.
We're forever grateful, Israel.
Yeah.
No, and honestly, all of you.
Oh, you guys are always welcome here. This is your house as well. I mean, you guys, anything you need, we're always going to be there to help.
Well, Israel, I don't know how long this interview is going to go on, but you have been magic yourself. We arrived at the hotel to be greeted by you to make sure that we were taken care of all the way through, and blended us right into the surgery room. Then Dr. Rincon, I mean, like the things that happened, Dawn, can you just talk a little bit about what you experienced sitting in the waiting room waiting for me to go through surgery?
Well, I mean, back in Canada, Ken has had some serious surgeries in the past. Cancer twice. We thought a stroke or possibly a TIA. So, unfortunately, we've been
living
in a lot
death
of
there.
hospitals. So we've seen firsthand, sort of what we would have come to expect as normal care in that sort of an environment. And here, 5 hours he was in surgery. I was hoping maybe at the end of the surgery I would get a phone call like I normally would, just to say that the surgery's over and he's in recovery. No, it wasn't a phone call at the end of the surgery. It was continual texts from Laura during the surgery.
From the operating room.
Hour from the operating room. So I knew when he was fully anesthetized. I knew when that first level had been placed. I saw a photo of Dr. Rincon
working
with
on
all of his equipment, and the screen behind Dr. Rincon showing that first cervical disc going in. I mean, I said, this is a miracle. I'm writing back. Thank you for letting me know that he's safe, that he's good. And she said, don't worry, I'll get back to you in a little bit. And I got another text. The second level, the third level were being placed. I mean, the comfort, not only to me, meanwhile, I could let all of Ken's friends and family know back in Canada that at this very moment, he's in the operating room, he's in good hands, everything's going well. I have goosebumps, honestly. People don't even believe when I tell them that. So I took pictures of all the
got you right to the recovery room, right?
All those texts, and everyone is just saying that is beyond a level of care that they would ever have expected.
The thing is, we understand how is it to be on that seat. So we want to make sure that you guys get all the tools possible. We want to help you.
You must quote what she said about how they care.
I said, Dr. Rincon has such a quiet confidence about him. I said, it makes me feel so assured that Ken is in good hands. And Laura said, it is Dr. Rincon's skill and expertise that gives him that confidence. And I thought that really said it all.
And what about the caring thing that you quoted? That she quoted to you about how they feel about the loved ones sitting out in the.
Oh well, she said we put ourselves in the family's position.
In the family's position.
She said we put ourselves in your position.
Yeah.
So again, it's just your compassion is amazing.
Yeah. No, I mean, We have amazing leaders. I mean, Dr. Rincon is our general director, and then Laura is our finance director. What better leadership can you have than those two
That's
people?
incredible. Then you get into the physiotherapy.
Oh man, yeah.
I mean, that's a whole nother level. In the physio, I mean, the care they've taken and the time and they're never in a rush. You get treated like you're the only person on earth.
You also did get to see Victor as well.
Get to see Victor. He's magic. All his tools that he has there.
He's our little magician. Yes.
I mean, everybody loves Victor.
True.
I mean, everybody.
True.
Like you just say, "Oh, I'm going to see Victor." Oh, yeah, I'm going to see Victor. Oh, you're going to see Victor. Oh, yeah, no, he's great. No, he's great. I know. I go and see him every day. He's great. Dr. Vanessa's fantastic. Yeah.
Reassuring us that everything's going well with the recovery.
And
she is an important part to continue that communication between
I've seen
doctors and
I've seen physiotherapy. Little Ida.
Yes.
Every day. Ida.
Uh-huh.
Oh, she's a doll.
Yeah.
And she's worked so hard on me every day. A little, come on, you can do a little more. Come on, yes, I know you can do a little bit more. Yeah, you just did a little bit more. Oh, she's been great.
It's good to push you a little bit. It's good to push so you can like evolve and continue.
Very motivating and really great. Gone out of her way, so far out of her way to make sure she did the best she could do.
Yeah. I mean, this has been amazing. I wish we could continue going on and on, but I would just like you to maybe to send a message for anyone out there who might be experiencing a similar issue to you, from your perception of where you were before to where you are now.
The first thing I would recommend anyone to do is get over here or get on. Do you do Skype or what?
Yeah, we can do. Yeah. And
talk to Dr. Rincon. He's open to have a conversation about your situation. You won't believe what'll happen. I'm just referring my own brother, Mike, who's going to be in a conversation with him in 2 days from now.
Mike, hopefully we'll get to see you here soon.
Mike, we're going to get to see you while we're here. And I mean, like I said, we can't say enough about the place. Anyone who has any, I mean, we've seen people here from all walks of life here to get different things done. I had no idea of all of the treatments that are available here.
We do have about 10 different specialists.
10 different specialists.
We do have, and we keep growing because obviously the most recent specialist that we brought is neurology. He comes once every 15 days, but that's a big specialized
and that specialist is going to see our friend.
There you go, Dr. Cesar.
Yeah.
So yeah, we keep growing. I mean, the whole vision of Dr. Rincon is to be able to treat you in an integral way, take care of you the whole way. Whatever you need, have a specialist there for you, so no information can get lost, and we can take care of everything.
Yeah.
So yeah, I mean, it's his vision. We all love it because we're helping. I mean, I am only marketing and public relations, but I get basically the best part because just being able to see how you come in and how you're leaving, the smiles. You guys look like you guys are radiant, just happiness.
We're delighted. We're delighted. Yeah, we don't
want a second chance at life.
Yeah, we sure don't want to forget Laura.
No,
If we didn't speak about her, she was. I mean, before we ever got here, just talking to her on the phone, I felt like she could be my sister or my daughter or whatever. She was just
so
reassuring, loving, kind-hearted, gentle, sweet person who guided us through, to make this an easy move. And it was seamless. The whole thing was seamless, right into the operating room, to the surgery, to the recovery, to back here. I mean, it was perfect. I couldn't say enough about it.
Oh.
God bless all the people here that work here, and you all work together like a happy, happy family. And you can't fool people with that. It's for real. It is for real. This isn't made up. This isn't a show you guys put on.
Yeah.
This is most real thing I've ever seen in my life. So we've gotten to know some really interesting, fantastic people here. And we're crazy about the Mexican people now.
I'm so glad you said that, because that is so true.
We're crazy about Mexican people.
We use the word genuine every day.
Yeah. We see you guys hug each other.
Yeah.
Now we're getting the hugs.
Yeah.
I mean, I'm walking up to strangers and wanting to give them a hug. People are going to slap me when I get home.
We're huggers. Everybody here is a hugger. I gotta say, we just love hugs.
I know.
So, Ken, Don,
Thank you.
this
Thank
has
you.
been nothing but magical. I appreciate you. Guys, if you guys are out there hearing this testimony, seeing it, make sure to subscribe to our channel. And if you guys have any questions, please, by all means, leave them in the comment sections, or specialists are delighted to just answer them.
Israel, anytime you want to pass out our name to anyone who's even curious about their situation, whether, at least for me to be able to share the experience that I've had, because we contacted a patient who was Dr. Rincon's, and came over, met us for a beer last week, drove over an hour drive just to meet us and talk to us. I mean, a total success story from him. He had the same thing as I had done.
And he's body surfing with his grandson now.
Yeah.
Oh,
Yeah, you know.
So we're creating community too.
Oh, yeah. Yeah. So, yeah, I mean, I'm totally available to speak to anyone who would like to talk to me about my experience here and how this whole thing went. And I know Don would be happy to share it.
Very happy.
No, well, I appreciate you guys. Thank you very much, and thank you for doing this for
Now,
us.
anybody that's looking at me, because I move like this, is bad. I'm still a little bit stiff, but I've been 3 weeks. They promised me 3 months, and I'll be doing this.
There you go.
I feel 100%.
Okay, well, thank you, Ken, Don.
Thank
Pleasure
you.
to have you guys.
Thank you.
And
Thank you.
just know, you guys, this is your home always.
And when the cameras are turned off, we'll give you a hug.
Definitely. We'll do it even now. All right, well, Ken, thank you.
A hug.
Oh, there you go. Thank you so much, guys.
Thank you. Thank you very much.